Welcome to Mental Health Mini number 34, Crisis Intervention. To start off, what is a crisis? So, a crisis is any acute situation that causes stress or disruption in daily life and requires severe emotional reaction and difficulty coping. Many individuals experiencing a crisis may require clinical intervention or assistance. A crisis happens to everyone at some point in their life, and it's oftentimes based on what their personalized beliefs, experiences, circumstances, and resilience is. Some examples of crises can be related to natural disasters, terrorist attacks, or school shootings. It could be related to changes in daily life, such as changes in jobs, changes in living situations, and changes in relationships. Or it could be related to natural growth and development, such as going through puberty, getting a new sibling, or starting school. Crisis interventions are things that we can do to help an individual resolve their crisis. This often includes collaboration of resources and can be done on a personal or a communal level. Oftentimes, crisis intervention can result when unsuccessfully in further stress and complications, or when successful in the development of resilience and adaptation. And resilience is the ability to withstand stress. Symptoms of a crisis could be experiencing severe or panic level anxiety, helplessness, feeling overwhelmed, having obsessive thoughts, poor focus, poor functioning, disorganized behaviors or thoughts, distorted thinking, or physical symptoms such as nausea and vomiting, fatigue, pain, headaches, tachycardia, and hypertension. The transactional model of stress identifies three stages of a crisis. So the first stage is a stressor occurs. The person then tries to cope with the stressor by using their comfortable problem-solving skills that have been effective in resolving stress in the past. When this doesn't work, they enter phase two, which is ineffective coping stressor, and anxiety increases. At this point, because their typical tried and true problem-solving methods and coping didn't work, they're going to use trial and error coping. A lot of times this is ineffective, so they enter phase three, which is reliance on any resources available. And then stage four would be reaching their breaking point, which could be exemplified either by exhaustion or further disorganization and severity of symptoms. A lot of times, if someone has reached phase four, they would require clinical intervention and possibly inpatient hospitalization. When we're looking at crisis response, we need to develop or assess the degree of crisis symptoms. As I mentioned earlier, crises are going to be experienced by people very differently, and this is going to be based on their personal values and beliefs. So, a patient could undergo cognitive appraisal where they look at how important that loss or the stressor is in their life. And if they can determine that the stressor isn't as valuable to them as they previously thought, that can help them build the coping skills to resolve the crisis. The amount of crisis response that they have is also going to be dependent on their support systems and resources, as well as the coping skills they've developed and the resilience that they're able to use. There are different types of crises, such as dispositional crisis, and this is an external situational stressor, such as problems at work or in relationships. There's the crisis of anticipated life transitions, and these can be positive things, but because they are a change and a disruption, they can still result in crisis. So, for example, going to college, having a baby, moving, or changing jobs can cause a crisis. We can have a crisis from a traumatic stressor, such as external stressors with no control. And one thing about experiencing a crisis from trauma is that the trauma doesn't necessarily have to happen to you for you to experience the crisis. You can be caused by hearing about it happening to a friend or a family member or something along those lines. Then we have our maturational or developmental crises, and these are related to natural growth and development. We have crisis due to psychopathology, such as experiencing an episode of bipolar disorder, anxiety, or having schizophrenia symptoms. And then we have our crises of psychiatric emergencies. So this would be a suicide attempt, a drug overdose, a drug reaction, intoxication, or psychosis. Interventions for a crisis can take place in any setting. We can use pharmacological treatments such as anti-anxiety medication, antidepressants, antipsychotics, fluid replacement, and any vitamins and minerals that the patient may need. Physically, we could provide any wound care needed, especially if the crisis is related to something like a terrorist attack or a shooting. We would do a physical exam and provide emergency medical care. Emotionally, we could provide psychotherapy, group therapy, empowerment and support, as well as coping and anxiety reduction skills. We could also help the patient with referrals to housing, finances, witness protection, law enforcement, or peer support specialist. A peer support specialist is someone that has been diagnosed with a mental illness and is in a state of recovery so that they could provide support and assistance to someone that's experiencing acute symptoms of that disorder. When we're doing assessment of a crisis, we want to know information about the stressor. How frequently was that person experiencing the crisis exposed to the stressor? What was the intensity of it? What was the duration? What was their physical and emotional symptoms, and how does that deviate from their baseline? What coping skills have they attempted, and has it been effectiveness? In particular, we'd want to know if they're coping with any substance use, because that can be a maladaptive coping behavior. We would assess them for any suicidal or homicidal thoughts. We would want to assess their support systems, as well as their perceived strengths and limitations in overcoming their experience of the crisis. Common problems and analysis associated with crises include ineffective coping, fear, anxiety, social isolation, disturbed thought processes, impaired self-care or ADLs, risk of self-harm or harm to others, and impaired occupational and educational functioning. Different ways that we can support someone that's experiencing a crisis is to orient them to reality, use a therapeutic communication, providing slow and clear instructions, as well as being non-judgmental. We want to stay with the individuals during times of panic. We want to set firm limits and boundaries. We can clarify the patient's perception of the problem, acknowledge their experience and emotions, and help them to explore those feelings in a safe environment. We could guide them through problem-solving skills that would help them to confront their problems, identify any contributing factors to the crisis, and identify any alternative strategies or coping skills that may be effective in helping them overcome it. And then lastly, we can help them identify support and resources. Then we have a form of nursing called disaster nursing, and this addresses crises of the environmental trauma, such as natural disasters, terrorism, shootings, and things related to that. With disaster nursing, we use more of a community approach to crisis management rather than an individual approach. We have our disaster ABCs, which would mean affecting and treating the patient or the community's affect, behavior, and cognition. With disaster nursing, because a lot of times it causes severe physical trauma, we would want to assess any physical needs first, and then once the patient is stabilized, we can help with any mental or emotional needs. We would want to provide support to the community in rebuilding post-disaster, and we want to monitor for the return of any trauma at pivotal marks for the community. The most common one that we would want to assess is the 1-year anniversary, but there's other events that can happen where we would need to assess the health and status of the community. So for example, if there's a school shooting, we would want to assess how the community is rebuilding and responding when the first day of school happens, when prom is supposed to happen, all of those different milestones that may increase someone's reaction and experience of the trauma. Lastly, with assessment of disasters, we want to assess the physical impact of the disaster and mobilize care, meaning, having law enforcement, emergency medical teams, volunteers to kind of address that disaster. And this is a very collaborative effort. We would also want to assess the emotional impact of the disaster. So is the community experiencing anger, fear, disbelief, sadness, anxiety, irritability, arousal, or sleep disturbances. And another thing that we typically see following a disaster is increase in substance use. Individuals may also be in shock, so they may not be able to immediately engage in a therapeutic communication or follow instructions or gain education. So we'd want to make sure that we're assessing their cognitive ability to understand what we're um, intervening with as well. Then we can assess the individual impact of the disaster and then the impact on first responders, especially because they may be traumatized by seeing the effects of the disaster and helping those as well. And as I mentioned earlier, we would want to assess the impact 1 year later or at anniversaries. And that wraps up our discussion on crisis management.